Welcome to the Cultivating Health Equity Stories podcast. In this captivating series, we delve into the heart of health equity, sharing stories that illuminate the path toward a fairer, more inclusive healthcare landscape. Our mission is to amplify voices, challenge norms, and inspire change. Here is your host, Dr. Throy Campbell, a research scientist on health equity issues.
Today we have a truly special guest, Jade Gibson. Jade's journey is nothing short of inspiring. Diagnosed with a rare germ cell ovarian cancer at the age of 16, she has transformed her personal battle into a passionate advocacy for adolescent and young adult cancer patients, especially in rural communities. Over the past 19 years, Jade has tirelessly worked to improve services and support for these patients. She also serves as a patient advocate for the Children's Oncology Group, continuing her mission to ensure better care and resources for young cancer patients. So join us as Jade shares her remarkable story and insights on how we can all contribute to better health equity. Jade, I'm so happy to have you on this platform. How are you doing today?
I'm doing quite well and happy to be a guest. Thank you so much for extending an opportunity to join you.
Yes, we value your time, and you have a rich story that's been helping a lot of people in this area, especially for young adults. I have questions here, Jade, but really I want to give the audience a picture of your background, your upbringing, because we think understanding one's background explains better how you deal with a particular illness, and in this case, a cancer. So my first question for you today, could you share a bit about your family and life before your cancer diagnosis, and perhaps talk about your cultural and social factors that shaped your upbringing?
Absolutely. Well, I was born and raised in Macon, which is located in central Georgia.
Hmm.
It's a city that I will say has hosted, we're known for the International Cherry Blossom Festival. We've been doing that since the 80s.
Yes.
And so it's also known to home for being homes for artists such as Otis Redding and Little Richard and the Allman Brothers, just to give a little historical background about where I'm from.
Yes.
But it's also a place that's considered a little bit more rural in terms of location. And it's in the heart of Georgia where a lot of people in surrounding areas come to shop and also get medical care. So, a little bit about me. I grew up an only child. My parents divorced when I was very young. And
Mm.
so I've only ever known the maternal side of my family.
Mm.
Um, and it's just been me and my mom for
Yeah.
30 years, 30 plus
Yeah.
now, but we have extended family, but we're not large in part. The extension of that family is kind of spread out, but for my immediate family, it's very small. My mother, let's see, she works in the manufacturing industry. And so in the earlier years of her career, we lived in a 2-bedroom apartment. It was filled with a lot of love and memories.
Yeah.
But I would say I grew up very sheltered as a child. And so I didn't have like a very big social circle, if you will.
Circle.
But very unique to my upbringing, I would say. Around the age of 9, yeah, I got a summer job at a little wig boutique. And that kind of broke up the monotony of it just being my family
Right.
and me. At
Yeah.
least then I was kind of able to get out, meet other people. And that shop owners, she actually had a daughter who was around the same age as me. So we
Right.
hit it off and I at least had another extension of direct contact with another friend of mine because my school friends were just that. They were friends at school, you know.
Mm. Mm-hmm.
So that's a little bit just about my upbringing and
Yeah, I appreciate it. It's colorful. It's rich, actually. You're saying you were mommy's little girl, and you had a
yeah.
special bond in between you and mom, right?
Yes.
Yeah, I can just imagine. And how was going to school? You said that your school friends were just friends. That's what it was. Can you tell us more about that? going to school, leaving mom on a daily basis?
Yeah, for me and my mom, that was kind of our roles. She went to
Yeah,
work, I went to school. School
right.
was good. It was interesting. I've always been kind of more of a loner, if you will. I guess
Mm,
more reserved, and how I kind of approach social situations.
right.
So for me, I was much more of a bookworm, if you will. I loved technology.
Yeah,
Those were kind of like my things, and
yeah,
so I kind of would say I felt a little bit kind of to myself in that regard. As most people, you grow up, it's more about sports or cheerleading or other extracurricular activities.
right.
That was just not my normal. And
I was going to ask you just that because I imagine going to high school, your friends participated in cheerleading and band practice and other clubs. How was that like, early high school years?
the early high school years, well, I was in the initial phase, I was only there for my freshman and sophomore year.
Yeah,
But I will say, I tried to get into certain things like getting into dance,
yeah,
but I think it was meant for me not to have that experience just
yeah.
because of the next few months that will follow after my
Right,
sophomore year.
right.
But
Yeah,
not so much. Like I said, and because I still worked, like I had that childhood job throughout
yeah,
treatment.
right.
So I had that until I was probably like 18 years old. So
Yeah,
it was interesting. I would say I have a very unique upbringing experience, but as far
yeah,
as like friendships and things of that nature, I grew up with the people that I knew since elementary school and middle school. So the people that I had gotten acclimated to, they were my
right,
friends throughout. It was just one of those types of situations where there was no hanging out,
right.
after school or going to each other's homes like that. My mom was very much protective,
Which
and that,
I can understand. Your mom's only daughter,
yeah,
and she is going to take care of her daughter and bring her up along a certain path, right? And
yeah.
it was important for you to share this personal information with us, Jade. We asked the question on purpose because we knew you got diagnosed at an early age, right? And so perhaps let's try to transition into when you discovered that you had cancer. Fill us in what caused you to think something was bad was happening, if you can tell us the story.
Absolutely. And I will say most of my symptoms and everything that I will share from here out will have happened in one occurrence, which would have been 2005. My symptoms started when I was around 15 years old. And the first indicator that we had was that my mother noticed my menstrual cycles were irregular.
Mm,
Um, I was maybe having one every couple of months.
mm,
And she thought that to be odd and made an appointment for me to see a gynecologist. And it was different from any healthcare experience I'd had before. We usually would just go to clinic or urgent care, if I had a cold or
right,
something. So this was a little bit more in depth
right.
and personal. It was the first time that I really recall being asked questions about my body.
Mm,
Um, and it was also the first visit where I had to discuss sexual partners.
mm,
So that was a bit odd and
yeah,
different because I had not had those experiences.
right,
For people to say, well, are you pregnant? Have you had
right.
any pregnancies? Um, and so
And that's how you're seen. Unfortunately, a young lady, a young high school student, missing your menstrual cycle, and you're thought of as being pregnant, and that's not easy to deal with, as it sounds.
no, it was a little uncomfortable because my mother was obviously right there with me. So
Yeah,
she knew the answers to these questions as well, but it can be just for sake of explaining that to your audience. If
yeah,
there's any medical professionals out there listening, it can be a little odd to have those conversations with the parent right there in the room. It is a
right.
little off putting for us as young patients, but I'll proceed. I will say the conversation kind of shifted from there. And so the doctor transitioned from talking directly like we are one on one to more so having the conversation with my mother. So I kind of
Yes.
became an adornment in the room, if you
Mm,
will. And as we got more into, what my symptoms were, what we could do to kind of offset that. There was an opportunity where an ultrasound was performed, and the
On
doctor,
that same visit. On
same
that
visit,
same visit. Yeah.
same visit. And the doctor thought he saw a tiny mass, which was just thought to be a cyst. And he said, well, that's normal. Women get those as they, their menstrual cycles come on. It's nothing to be concerned about. And so, of course, 6 months, I would say, would pass following that initial appointment. And in that time, I visited the ER, I visited urgent care, and the primary care physician over multiple times, which was difficult because at certain points, my symptoms began to progress. So I would be
Mm.
dealing with nausea, vomiting, very fatigued, and some physical changes that would be the protrusion or bloating of my abdomen. And we spent a lot of time in the waiting, just trying to diagnose what the issue was. And everybody would say, you know, just take Motrin, give it 3 days, you'll be fine. Because everybody thought my issues were menstrual related.
And I think your age had a lot to do with it, right? Who would think for a 16-year-old girl to be having cancer? I know it must have been difficult for the physician because, again, your age, a high school student, an active high school student, and perhaps just missing your menstrual cycle. So it can't be much worse than that.
It's a good question. And I've often kind of waned with that because there's a part of me that feels like if I had just had somebody, I think, to really listen. Because in my experience, after a while, it started to just feel like I was being dismissed or disbelieved because it's the same outcome every time I go, no matter where I go. And it was just hard to keep going because I'm depending on pain medication to get me through from period to period, or I'm leaving school after, an hour and a half and one period because I can't physically move to get to the next class or I'm sick. And then you have, like, at one point, I believe my mother, kind of questioned, well, is she just trying to avoid going to school? Is there something else going on?
Right.
So there were other factors, I think, that outside of the medical perspective, people don't consider for the child who is going through that as well. And like you said, when it comes to pregnancy, you're a teenager. So
Yeah.
if my abdomen is starting to protrude, I have
Hmm.
morning sickness in the early period of the day. You get those rumors around school that,
Wow.
maybe she's having a kid or something like that. So there's a lot of different factors that come into play with that.
So there was a social stress there, a stressor of
Oh,
your
absolutely.
peers looking at you, wondering why are you looking like this? Why are you missing school? Why are you always sick?
Absolutely. And so it just adds the pressure. And like I said, you're depending on medication to help you cope through the day. So I'm fine when I take it because it's going to make me sleepy. When I wake up, that cycle starts over again. And it became very difficult for my mother. I think at one point she found me in a closet just crying because I was very frustrated I keep telling everybody the same thing and nobody believes me. And I was taking medications that were probably not for me because they were
Yeah.
prescribed by other people, but it was
Right.
for pain relief. And they said,
For
well, maybe
pain.
it'll help
Yeah.
you.
Right.
And she was like, you cannot be doing that. So it wasn't until we went back for the follow-up visit, which took about 3 months.
And before you get to the follow-up visit, and forgive me here, Jade,
Yeah,
because
you're fine.
I know there are a lot of young misses who are struggling even with regular menstrual pain, in particularly in the Black community. Endometriosis is a challenge, and so we write it off and say you're young, and perhaps you're Black. You can manage the pain.
Mhm.
We're tough, we're strong, and that must have been wrecking, emotionally
Yes, just to kind of give, because I always want to give context as well, but
yes.
set the scenario up. In between that time, when I say I'm taking these visits and I'm missing school and my mother is missing work and things of that nature, there's hours that go into these visits of
Yeah.
waiting.
Yeah.
Again, not only if you're at the emergency room, I think that's kind of anticipated for you to wait, but even where we were treated at for primary care, it was in a neighborhood that really wasn't the best, wasn't the
Mm.
safest. But this was a clinic that most low income families go to.
Mm.
And we had been going there, like I said, for minor things, like if I had a cold or if I had some other small thing minute going on, we would go there. But the waiting was the worst part, because it was one
Yeah.
of those places where the doctor
Underserved. Yeah.
appointment, but you would be there all day.
Yeah.
And he had a very small clinic location. So if the waiting room filled up quite quickly, you would be sitting in your car with the door locked, waiting for someone to come out and tell you, okay, it's your turn. It was not upkept. It was it wasn't, like I said, in the best area. You were constantly kind of like looking over your shoulder. You wanted to really get in and out, but it was low cost to us. And I will also add that we had never really had to utilize our medical benefits in a
Yeah.
way. You know what I mean?
Yeah.
So
Yeah.
this was the most active we'd actually been going to visit physicians since I had been a kid.
Yeah. Healthcare providers tend to stereotype in different communities, and where they assume things, and without getting to know you personally, without probing on your personal living situation,
Hmm.
and with your health issue at the time, without that sort of conversation, you could not open up, I imagine, and express yourself the way you wanted to. They wanted you to get into the clinic and get out, I imagine. That must have been frustrating, and that delayed what you want to talk about now, your eventual diagnosis, right?
It did, and that added again to that just feeling of being dismissed. Let's, like you
Hmm.
said, get them in, get them out. You start to feel
Right.
more like a number than a person.
Mm.
And I'm a believer that healthcare is still a customer service industry. It should
Right.
be that way. It's not always, but I really feel that way. And when you're dealing with a child, there's a level of care that has to be there.
I'm involved with a lot of young people in my corner, and you're opening my eyes to things that we don't normally think of, especially for our young ladies, right? So take us to when you were diagnosed then
Yeah,
at the time.
absolutely. And so to your point earlier, that would be kind of the first time I felt like I had someone in my corner who really was
Yeah.
listening to what was going on. So,
Mm.
like I said, 6 months passed, and we went back for the follow up visit with the gynecologist. And it was in that time that my mother and I told the same story. What these are her symptoms. This is what's going on. But at least then it was taken a little bit more seriously. He was very proactive. We did another round of labs, and we did some additional imaging. And that's what I felt like I wished someone would have done. The most that I
Mm.
had done in that time was a chest X-ray. So I
Wow.
feel like if someone had taken time to really like look at my abdomen, we probably would have caught it
Mm.
earlier on.
Mm.
But I say all that to say he did the additional testing, and it would be, I'm not sure how long, but eventually they called my mother to give her those results. She was getting ready for work, and she said she got the call that, it's stage 3 ovarian cancer.
It must
And
have been frightening.
that's what I say. I'm sure for her was hard to hear. Sure, for her it was even harder to relay. She did not tell me that immediately upon getting the diagnosis. She waited until I finished the school year, which was
Wow.
probably a couple of weeks. We
Okay.
were
Okay.
nearing the end of
All
sophomore year,
right.
yes. So we were getting out for the summer, and I had like this whole thing of what I was gonna do over the summer.
I can imagine.
School. Yeah,
Yeah.
and, she sat me down and she was just like, well, the doctor called and we got, the results back. We know what's going on with you. There is something, happening. She laid it out what it was. And I don't think I fully like understood you have cancer, because I know with very many of my adult friends who have had a cancer diagnosis, hearing the word sends them into, a spiral.
Right.
And I get why that is. But for me, it's possibly just because I had worked around in that particular summer job as a kid people who had different diagnoses and medical conditions, including cancer, whether they be adult men, children, or women, because we're
Hmm.
providing cranial prosthesis, which is for people who
Okay.
don't know, helping them find a wig or some form of a
Right.
or head covering during their
Yeah.
treatment. So I had
Right.
dealt with people with that particular medical condition, but to hear it for myself, I often kind of relate, and I don't think I was prepared or understood what
Or
that
could you be? Yeah.
meant. Um, and from there, things kind of ramped up. They give you the ideal of this is what you have. So we went back and had that conversation with the gynecologist, of course, and they told us next steps would be surgery. But before that, I do want to point out that my mother, she, without knowing it, I think just was the best advocate because it took us so long to get the diagnosis. She wanted to get a second opinion. So we did
That
travel.
is great. That's good.
Yes, she's just the best.
Yeah.
But she did take me to the Children's Hospital in Atlanta, and we did that second consult just to confirm not only that the diagnosis was accurate, but is the treatment regimen ideal for
Yeah.
what he has.
Well, Jade, you're finishing up the school year, and like any young miss, looking forward perhaps to a some social event, some vacation, perhaps, and perhaps working and earning a few extra dollars, no assignment, and to learn at the end of the school year that you have cancer, and to then learn that you're going to have a surgery as a young lady. You haven't started your life just yet. You must be thinking, am I going to be able to get pregnant? I don't want to be telling your story. Just take us there. Other thoughts you were having at the time.
No, you're
You
doing
know,
fine.
I'm doing fine.
Yes, that is actually because I didn't have, like you said, I didn't know what to ask.
Hmm.
And as I soaked it all in, and I'm gonna kind of take us to the consultation with the surgeon. When he
Yeah,
asked me if I had any questions, what you just asked was the only question that I could think of. Is will I
that
be?
was your early question.
That was the question. 16,
Wow.
and I want to know about my fertility.
Of course, of course.
It was the only thing to come to mind at the time, because the way he explained everything, it was very invasive. And he could not tell us really what the outcome would be until he started the surgery.
Yeah,
So with that, it left a lot to be like, I think it set in perspective. This is serious. Like
right.
this could be life altering for you. Um,
Mm,
and I had never had surgery before, so it was
yeah.
probably a lot of overwhelm, I would say, for
I'm not a medical doctor, but I like to probe. The doctor was saying to you, there's a chance we have to remove your entire uterus, and we don't know. We have to go in first. Wow.
yes, we don't know if we'll have to do full hysterectomy.
Yeah,
Yeah. And it's a
that
lot.
must have been alarming.
It's a
So
lot to
bad.
process.
Yeah,
Hopefully I knew a little bit about, women's bodies and things, but
yeah,
just to kind of add to dialogue, as we mentioned earlier, have to be cognizant of how you relay this information to young people because
yeah,
sometimes we haven't had the experiences to really understand medical jargon or terminology. So
yeah.
it's a lot to take in. But I will say for me to feel like, and I don't want to jump the gun in our conversation, but to feel like I could be heard by medical professionals. What I think I would like for medical professionals to understand is how you talk to me is how I'm going to dictate to you in the future. So,
Yeah.
in order to feel like as a Black patient, I was not being dismissed and I was actually being heard, I started to kind of adopt to how people spoke, healthcare professionals spoke to me.
Mm,
That way I
mm,
could feel like my thoughts and feelings were actually being communicated.
yeah. Oh, we're going to probe that a little bit.
Okay.
Now, so surgery came about, and what happened afterward? You learned exactly what your situation was.
So surgery came about in, let's say, June of
Hmm.
2005. Surgery is in June. I go home to recover. Recovery is hard. Um,
Yeah.
I did not understand how much you utilize your body mobility wise, especially your abdominal and your back. So I had staples, metal staples. And it was difficult because it hurt to breathe. It hurt
Yeah.
to laugh. And I had vertical
Mm-hmm.
incision. And so that was very difficult in terms of moving around. I did have a fall, unbeknownst to me, I was losing my balance. So that caused, of course, alarm for my family.
Yeah.
For lack of better words, they kind of treated me like a China doll throughout the entire cancer journey.
Yeah.
I was very delicate, a delicate
Yeah.
flower, if you will. And so
Yeah.
it caused them to kind of really, okay, we need to make sure somebody can be here with her, which is good and bad.
Mm-hmm.
It's good and bad. We'll get into that a little bit later.
Yeah.
But
Right.
it was they were the best caretakers. My they being my mother and my grandmother,
Right.
who stepped in as well to assist with my care. But it was hard. Just the surgery itself. Kind of getting back to building up my physical strength, I think, took a
Right.
toll. And it's difficult. You can't really find a comfortable position, whether you lay, whether you sit. That probably was one of the hardest parts.
Right. Right.
But,
As a young
with
lady.
that
Yeah.
surgery, if I could add, I did lose 1 fallopian tube and 1 ovary, and I still have
Okay.
the left.
Okay. I'm happy to be here. I know this is 19 years later, but it's good. I was anticipating the worst, for some reason, but that's good. So after you heal and recover your strength somewhat, it was time for treatments, right?
Yes, which consisted of 8 rounds of 3 different chemotherapies.
Hmm.
The first, 2 were etoposide and bleomycin. The most aggressive of those 3 would be cisplatin. And I started that on July 4th.
So how was it? Talk about side effects. What toll it had on you.
Chemo initially because they hadn't introduced the cisplatin in the first round. So
Yeah.
I was breezing through and I thought, oh, this is what it is. This is fun. I can do this. This is great. It's all right. This isn't bad.
Yeah.
And by the second round, we were adding the cisplatin, which they did increase the dosage of that as well. By the second and third rounds, I was like, okay,
Yeah.
this
Yeah.
is definitely starting to feel like how I've heard it described. The chemo definitely added, of course, the nausea, the vomiting. I began to lose my hair, I think,
Right.
which was very hard for my mother, more so than myself. I would have been fine just completely shaving my head off because I
Yeah.
had seen this process
Right.
done. I'd been part of it, hosting wig parties for customers and everything. So this was familiar to me. I did not have that
A
typical.
mom was seeing her beautiful daughter lose her hair, and that wasn't easy.
Yeah, and I did not
Yeah.
have the typical aversion that some people go through with hair
Yes.
loss. As far as for her, it was definitely one of those things where she was just like, no, just let it naturally, kind of do its thing. But that was also bring that up because that was also hard for me
Yeah.
because you're going about your normal day and as you brush your hair, you're
Yeah.
losing it, or you're showering, you're losing it. So it was very, I say that to say for parents who may hear this, it is understandable that it is a loss for you. There's a hopelessness, I think, in the sense that you can't help your child, but there's
Right.
also the other side of coping. So if
Right.
they have things that they would like to do, if they want to do a cut or, you know, shave it or whatever makes them feel comfortable, please take that into consideration as well, because it's a psychological process and it stays with us.
Do you feel like your body was totally against you? You felt foreign. Y- I'm trying to get into your
State of mind.
state of your mind at the time.
No, I will say, I don't know. I might be one of the unicorns in this, but I took on because I saw the stress that it put on my family members.
Right.
I took on the survival mode aspect. So I'm trying
Mm-hmm.
to be the brave one for you all.
Mm-hmm.
I'm armored, to kind of compartmentalize and keep it in there so that they can continue to have hope and faith that we'll all get through this.
Right.
I think when it comes to kind of like being in my body and side effects, the most that comes to kind of mind at the time is just the weight loss that weighed on me the most.
Yeah.
At my smallest, I was 98 pounds.
Mm-hmm.
And I think that's a lot to process your frame.
Right.
And also too, to add to that, post the initial surgery, my cancer did spread, so I had to go back in to remove lymph nodes. So now I've had a second abdominal surgery. Um, and the one scar I was dealing with that, but the second one, and they kind of, just to give a visual aspect, they do meet together. But it was just
Right.
a lot to look at my body and the changes. And it's just a lot to take in. But that weight loss definitely stuck with me because nothing fit. So I didn't feel
Right.
comfortable in my clothing. I had to get all new clothing. And then I was, like I said, I lost my hair. So just looking at that, it was a lot.
Thanks for listening to Cultivating Health Equity Stories. Remember, our mission is to amplify voices, challenge norms, and inspire change. Go to cultivatehealthequity.com, sign up on our email list, subscribe for future episodes, and find the resources mentioned in the show notes. Until next time.